Alrighty, I'd call to order the Tuesday, June 16th meeting for the Natrona County Board of County Commissioners to order. May I have a roll call?
Commissioner Coates.
Here.
Commissioner Laird. Commissioner Nicolason.
Here.
Commissioner North.
Here.
Chairman Mill.
Here, if I could get everybody to stand and say the Pledge of Allegiance, please. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And first up today, Natrona County Collective Health Trust Annual. Who wants to speak first for them? Eric. How are you doing today?
Doing well. Thank you, Mr. Chairman. Commissioners, I won't take very much time. Eric Nelson, I'm the current chair of the Collective Health Trust. We've got a lot of information to provide to you today. Friends from PYA are in attendance, as well as representatives from Banner WMC. So unless you have questions for me at the outset, without further ado, I'd like to welcome the PYA crew up to present their findings.
Go ahead. Good afternoon.
Mr. Chairman, I apologize. The deputy noticed my flat tire out there, so I got it over to the shop and then had to walk back.
Uh-huh.
It's the truth.
Uh-huh.
I couldn't make that up if I tried.
Whatever. You're a lawyer. You could.
Yes, and you're not.
I know. You tell me all the time. Go ahead. Or we'll keep going.
We do that too.
Can you hear me okay?
Mhm.
Well, good afternoon, and thank you once again for having us here today. We are here to walk through our report from the 2025 period related to the independent assessment that we conducted related to Banner and Wyoming Medical Center's compliance with the covenants. And so we're going to talk through some of our work steps that we conducted and some of our findings from this prior year. Just a quick introduction. I know we met with you all last year. I'm Shannon Sumner. I am one of the partners with PYA. I also lead our regulatory compliance service line. Also with me is Leanne Odom, and so she brings experience in operations and performance transformation, and Karen Anderson, who brings legal and clinical expertise. And today we provide that balanced and independent perspective. So just a little bit about some of the things that we're going to accomplish today. We're first going to begin with a refresher of our role as your independent monitors and methodology. Then we're going to cover some of those stakeholder interviews. We had quite a few as well this year. And then we're going to move on to those findings. We're going to highlight the key areas of strength and areas of what we're going to talk about related to partial compliance, summarize some of those major themes, and then leave certainly some times for questions. Again, a little bit of a refresher about PYA. We are one of the top healthcare consulting firms in the country. We are a top 100 accounting firm, and I think that speaks a lot to the work that we've been asked to do from an independent monitor perspective. And we are firmly committed to maintaining that level of independence. We are not owned by anyone but the owners. We do not have any private equity or other types of investment interests. And so, again, I think that speaks to our credibility and our objectivity. And our role is to serve as that independent monitor. We evaluate compliance objectively based on those requirements that were set forth in the covenants. We are not here to advocate, but rather to provide that unbiased assessment to support your oversight responsibilities. I'm going to turn it over to Karen.
Okay. Just a refresher, really. Oops, can you hear me? Refresher, really, from last year. So the scope last year, we came and we looked at the calendar year of 2024, and we looked at the hospital's compliance with the covenants. Really, are the key terms of the transaction agreements from the sale of the hospital. And so, so our assessment this year is for the calendar year of 2025, and our process really is to Start with really review the transaction agreements that everybody, negotiated, signed at that time in 2020 with the sale of the hospital that involved Banner, Wyoming Medical Center, the county, and the trust. And then we also put forth a request to the hospital to provide documents on each one of those covenants, and we review those. We also, and you'll see a lot of the folks in the audience, we interview a lot of people. We interview physicians, hospital leaders, folks that can really contribute and help us understand how they go about complying with those covenants. And then at the end of it, we assess generally, it's boiled down to sort of 17 covenants or 17 main things in the agreement. And those are that really it's an assessment of about 74 different requirements. So you'll see in our final determinations, it'll say fully met, or it might say partially met, because there's several requirements for each one of those covenants. So maybe you met 5 and there were 2 remaining. So we talked a little bit last year about partially met. So that's sort of our methodology for that. And then let's see. Is that the next slide? Yeah, and then we wanted to give you a little bit of timeline since we saw you last year. So after the July meeting last year, we reported to you on 2024. There were 4 that were partially met, and there were 13 covenants that were fully met. So following that, we just want to let you know the trust asked the hospital, they said, could you provide a corrective action plan and tell us how you could bring yourselves into compliance on those 4 partially met? And the hospital did that. We assessed that and provided comments back to the trust. And there were some gaps that remained at that time. And then since then, we all moved on to just sort of start evaluating where we sit in 2025. So today, that's what we'll give you an overview of. The next one. And then finally, as I mentioned, I think the key components, Leanne did a lot of the interviewing, as did Shannon, are the key stakeholder interviews. And we just wanted to let you know how helpful that is to us. Everyone, lots of folks here provided a lot of time. We interviewed about 20 individuals and groups who provided time about how they were involved in the compliance with the covenants. So that's from the county commissioners to the trust, Banner, Wyoming Medical Center, physicians, physician leadership, and then other involved persons. And the topics range really from governance, advisory board, which we'll talk about a little bit today, healthcare quality, healthcare operations, capital commitments, and the community perspectives. And then finally, and then this is sort of our summary of the report that we provided to you earlier in, I think, end of April, or it may have gotten to you in May. So the findings of our independent assessment for the hospital Wyoming Medical Center's compliance in 2025. For 2025, of the 17 covenants, 13 were fully met. 3 were partially met. And 1 is not applicable because it's a capital commitment that's not due until 2026. So you'll see we wanted to put it side by side with 2024 so that you'd see that really those partially mets are really similar to last year. But I'm going to turn it over to Leanne, who's going to give a little more detail of the findings because there have been a lot of good changes over the last year.
Thank you. Before I jump into all of those findings and we go into greater detail, I did want to take a moment to talk about.
Excuse me, I don't take your
This on? Let's see. We'll just trade it out. Sorry about that.
There we go.
Is this better? Alrighty. So before we jump into the details of those key findings, I did want to take a moment to talk about some key themes because I think it provides a really good overarching summary. You heard Karen talk about those key stakeholders and the scope and depth of meeting with the various key stakeholders was pretty vast, from hospital leaders to people involved in the community. Also people that are concerned and have, have a deep desire to express themselves. So One thing that we really saw emerge and really wanted to mention is that across all the findings, what we did observe was a shared commitment to providing high quality care. So regardless of individuals' perspectives or lived experiences, everybody in this community is rallying around a common desire to really have high quality care available. Other key themes included maintaining essential services. Everybody is eagerly wanting to support Banner's Wyoming Medical Center to continue to grow and expand, again, on that strong foundation of quality, safety, and satisfaction. There is a deep desire to ensure the voice of the community is heard, and also a lot of interest in understanding how those capital expenditure commitments are being tracked and met, which Shannon will talk about later. So again, these key themes really help frame both the strengths and the opportunities that we'll touch on in detail. All right, so as we jump into the detail of the 3 covenants that are classified as partial compliance, we did so in a fashion that really put them all together on one slide, and those include covenants 5, 11, and 14. And the reason that we summarize those all together is you heard Karen talk about across the 17 covenants, there are actually 74 different, like individual discrete things that we're looking at. So, the common theme in all of these, in these 3 covenants, 5, 11, and 14, is the advisory board. And specifically in covenant 5, all of those discrete items, if you will, are dedicated to functions of the advisory board. In covenants 11 and 14, it's the advisory board represents one out of many other areas that are included in those covenants. So just wanted to make sure that everybody had a shared understanding of that. And we saw improvement in information sharing with the advisory board. So we sat here last year and we talked about opportunities related to the advisory board. We have seen a lot of growth and maturity happen in the way that that group comes together and communicates. And frankly, the information being shared with that group has improved significantly. Again, I mentioned Covenant 5 is really dedicated to the advisory board, and there were discrete functions that last year were not met, and this year they have been met. So there were items in there, particularly around the functionality, that did improve. However, there is still an opportunity to really strengthen how the board is engaged, particularly in incorporating community input. So I really want to emphasize that that is the area that needs to be improved upon. So if you think about that information sharing and pushing information out, that represents where Banner Wyoming Medical Center team has grown significantly. But that conversation, to be an engaging conversation, really needs to happen in a bi-directional or a multi-directional fashion. And the language in the agreements talk about gathering community input. So the advisory board is really charged with the role of gathering community input and then using that community input to interact with Banner Wyoming Medical Center. So lots of opportunities remain. As part of the board's growth and maturation process, we would expect to see improvements in those areas. So again, the intent around these covenants is really about engagement, not just unilateral communication. Okay. I'm going to turn it over to you to Shannon for the.
So if you recall last year, one of the areas related to capital commitments was partial. And that's because as of 2023, Banner Wyoming Medical Center should have dispersed $30 million. So if you recall, there was a significant amount that had been allocated but not yet been dispersed. We interpret dispersed expenditures cash out the door. So when we think about the fact of, again, last year, there was still an opportunity to capture items that are not necessarily considered capital, but it's also allowed within the covenants. And those include like expenditures for physician recruitment and other types of strategic investments. So this year we met and spoke with Wyoming Medical Center on capturing some of those dollars. So some of those dollars have been captured in terms of this year's annual report, and that includes a little over 2.6 million that were invested related to physician recruitment. So that's great. But for 2026, so by the end of 2026, the commitments require an expenditure of total of at least $60 million. So when you think about what's truly required for this year, that's why we have, if you think about the chart that we just had of not applicable, but by the end of this year, they have to at least have dispersed $60 million. So when we were looking at the data that was supplied to support that, they are on target for that. So of the total that's been allocated, 44 has been dispersed to vendors. In addition, they anticipate dispersing more than 31 million in 2026. So they really are on target, but we will not be doing that detailed analysis of that 60 million until this time next year. So that was a quick summary because of the work that we did last year. I do want to reiterate the things that Leanne said, is that everyone that we met with, including some of you as well, definitely distributed the information to us in a way that really articulated how important this organization is to this community and to the patients that are being served. And so we really appreciate your time today. We're going to open it up if you have any questions for us that we can answer for you.
Mr. Chairman.
Go ahead.
So what I'm concerned most with, sounds to me like they're taking care of this money issue. My biggest issue is quality of care. Now, do you feel that you look into that, or is that just something that the foundation does, or? Because I, as an attorney, lately I've heard some complaints that are astounding as far as community of care, or
Quality of care.
the quality of care. And so I could give you an example. Guy goes in for back surgery. Doctor, I think, comes up from Phoenix. The guy gets cut on, but he doesn't get the back surgery finished. And about 20 days later, they have to cut his leg off. Now, I hear stories like that, and then I check this one out. There's truth to it. But as a county commissioner, you know, my constituents vote me in or vote me out. And I am a person that is from this county, born in this county, raised in this county. And I don't want my people hurt. So do you have anything to do with that at all?
Yeah, and certainly what you described is a horrific account. And I think when you look at healthcare across the industry, we have all heard horrific accounts. When we look at the context of the covenants, in covenant, I believe it was 11, looks at quality of care. What that covenant really looks at is if in a consistent operational way, Banner supports by way of processes and key tools and policies, the same level of support infrastructure, if you will, and operational deployment to support quality, patient safety, patient satisfaction across their organization, particularly in the Western region. So as part of that assessment, we worked with the Western region leaders, both their president leader, as well as their quality leader and chief medical
Come
officer.
back to me on
Mhm.
this hospital.
Yep.
This is the one I'm concerned with. And, you know, the lawyers hear about this first,
Mhm.
usually. And sometimes the public doesn't hear about it at all. And all I'm seeking is that these elderly people get a fair shake at this hospital. And I could go on with some other ones, but I'm not going to do it now because all I'm trying to do is light a fire under somebody to up the quality of care. And I know this. we have great Wyoming people working in that hospital.
Mhm.
I talk to them all the time, and I know we have some very good doctors, and we have some very good nursing. We have, I'd say most of the people working there are great people. So I don't understand how some of these things have happened since Banner came in. And yes, there's tragedies in every
Mhm.
hospital,
Mhm.
but a guy who comes in a wheelchair and is vomiting blood and is left in the entry room, and they don't take him into the ER, and he dies in his wheelchair. And everybody's saying, geez, you should get him back to the ER. I have it on camera. These things bother me as a county commissioner because, I hear a lady goes up there, she hurt her hand, they think her hand's broken at the home, they send her up there, that she's there 30 minutes, they say she doesn't have a broken hand, they bring her back, her hand's still hurting, they send her somewhere else, she has a broken hand.
Yeah.
So, the money thing is great,
Mhm.
and you guys looking at all of those things, and I think we have good people on our board as well.
Mhm.
And so, how do we solve this kind of thing I'm talking about? Who do we hire to go check this out, other than filing lawsuits?
Well, I think as I was explaining, what's in the covenant around the tools and infrastructure to support quality. And, there's a book that's called To Err is Human, right? So, and the stories you describe should disturb anybody as a human, not as a commissioner or, like certainly as a commissioner and leader in the community. But we should all care about that. And the relevance of looking at both the commitment document as well as assessing what's happening from a structural and process and tool perspective in the Western region, and then looking very locally right here in this community at Banner's Wyoming Medical Center Hospital, working directly with their leaders, including their chief medical officer and chief of staff, to find the evidence to say, are those processes implemented here on a local level, is what we were charged to do from a quality assessment, not a peer protected case by case review. Those are two very different things.
Commissioner Coates.
So, I guess in part answer to Dallas's question, I had the opportunity to speak with some Banner leadership in the hallway before this meeting, and um, you know, I have some concerns about care in our community, but I think Banner can step up to the plate. I've talked to a few of the surgeons. There's some fantastic vascular surgeons we have, and I think this report documents that there is meaningful effort being made in recruitment and some retention efforts. And I think Banner will step up to the plate to keep these guys that are reducing some of some tragic outcomes. So, and keep these guys in our community, because I think that's part of this, is keeping good doctors in our community and not having to just import every week a new doctor, because I think that's part of how we build a better medical community. I guess secondarily, what recommendations do you have for this board to look at as far as the communications with the advisory board? That matters to me, and how can Banner improve that?
If you could clarify, I'm sorry, the role of you all in that, or
So my role is every time that you guys come in front of us and talk to us about this, we get a whole bunch of questions from the public, and we have to answer that. And so we'd like to see, at least I would like to see, Banner meet all these things. And so from this board's perspective,
Yeah.
with your kind of advising, since you do this professionally,
mhm,
how does Banner
yeah,
elevate themselves, and how do they meet that?
yeah. So, okay, thank you for clarifying. The folks that sit on that advisory board are really charged with the task of engaging with the community and getting that feedback. And then working with Banner Wyoming Medical Center to affect change, right? To make recommendations, to help shape what that medical center is for this entire community. Strategic planning, services being offered. It's really a partnership, and it really starts with the people on that serve in that role, and the commitment to get that feedback. And it does require effort. It needs to be multimodal. It's not just, oh, we're going to have a town hall and call it good, right? It is collecting information, a variety of modes, because everybody interacts differently with, information sharing, and really collecting and synthesizing that information and then doing something meaningful with it. There's also a lot of research that suggests when you have really great communication with patients and families, your quality skyrockets. It just continues to get better and better. So the more that those mechanisms can be hardwired, and there's certain things that the advisory board can do to hardwire that, there's certain things that can happen within the four walls of the hospital to hardwire that. It's the recipe for success, right?
Commissioner,
I was just going to add on to that.
Me too, go ahead.
Yeah. So it's the middle of June. There needs to be some considerable effort put into the things that Leanne has mentioned related to the advisory board between now and December, or we're going to be sitting at another partial compliant. To Leanne's point, I do think there needs to be that greater level of structure and engaging in the community. I think it's going to help elevate some of those concerns that you mentioned related to patient safety and quality, so that there can be that bi-directional input and just ensuring that that information is being heard and it's being actually utilized between now and the end of the year.
Yeah, and I'm just gonna add one point. So I think sitting in your position, right, it's just, so where can you get updates? And that's sort of one thing that the trust did after we left the meeting last July was, so let's put together an action plan. That's something the hospitals are very used to doing. Like, we always have room for improvement on things. And so it could be something as simple as that, sort of put an action plan together. What changes will be made in the next 30 days, 60 days, 90 days. You can really see the next 6 months, what's the plan, and then you could just get updates on what's been implemented. That might be an easy way for you to track.
Sure, I appreciate that.
go ahead.
Thank you, Mr. Chairman. Ladies, thank you for being here. Thank you for PYA's efforts. I think that you recognize that we care a lot about the healthcare of our community. When does the advisory committee meet?
Tonight, I believe.
How often do they meet?
The agreement mandates that it meets at least quarterly.
And
Yeah,
has it met quarterly over the last 12 months?
In 2025, it did. It had,
It
we
was the
reviewed,
previous year that it didn't.
correct. It did not meet quarterly as required in 2024, but it did in 2025.
So part of what you were talking about is an expectation that the advisory board members are going to go be proactive and get out into the community. But are those advisory committee meetings open to the public? Are they, is notice published? Can everybody show up and communicate their concerns or get information at those meetings?
So the support agreement does not have that as a requirement. I do not see, based on what I reviewed, that it functions that way. What has been implemented is a website landing page that the community can access. That was not within the 2025 calendar year. That'll be part of the 26 calendar review, but that is something that we noted as a difference. I also want to note that the support agreement requires a minimum of quarterly meetings. That's the floor, right? So
Do you think that it would be a challenge for those to be open meetings for the public? Why can't they be public? Why can't we invite the public, invite members of this commission to attend those?
I think that there's no reason they could not be.
So even if it's not required under the support
Correct.
agreement.
Yep, it's not required, but you could certainly position, I think, collectively working together between the commissioner group, the trust, and the hospital, you can always do far more than what's required.
Did I hear that you're going to institute or assist them to create an action plan for next year?
Sorry. We did that last year. So when we left the meeting, we said, you're fully compliant on 13. So could we see an action plan on the 4 where they were partially compliant, and they did submit one. Um, and, and there was still some gaps in that, probably to get to full compliance. So, it may just be a matter of fully implementing some of those measures still.
It seems under the partial compliance, page 157 of your report, the advisory board was not involved in advising or providing input on enhancing the programs or sharing best practices. So it would be my hope that for this coming year that the advisory committee can really focus in on that, because I think that kind of goes to what Commissioners Laird and Coates were talking about, is the quality of care is critical. And I guess along with that, do you believe in you've talked to the advisory, or at least some of the advisory board members, do you believe they're of the quality and caliber to actually do a good job?
I think some of them, in the conversations I've had, are capable and interested. It's hard to gauge it across the board. It is a time commitment and it requires that commitment and passion to do so.
Thank you, Mr. Chairman.
So, real quick, Dennis.
So I meant to say this, and I remembered it because I've had so many comments made to me about this meeting and what we hope to accomplish. And some very strong statements were used about it's time maybe for the citizens to have a war with high taxes and how the hospital is treating a lot of people. Now I took that as meaning a political war, but there was hurt in their eyes. There was anger in their eyes. There was pleading in some of their eyes. The elderly people that are scared to death that they could lose their house because they can't pay the taxes. We get that here quite frequently. And then these calls that I get about what's happening to people at the hospital. And it's a lot of elderly people. And that concerns me dearly, believe me. And so when we have this nice meeting and you very intelligent ladies and the place is packed, that isn't helping my constituents one bit. Unless somebody starts kicking some dust on somebody. That's my metaphor. And so I'm saying that not only to you three, but to everybody in this room. Because if we don't stand up for each other, something may happen to you that you really don't want to have happen to you. And you know, when you're fighting a billion-dollar corporation, billions of dollars corporation, that isn't even from Wyoming, sometimes I wonder just exactly how much they do care about this little community. And I know how to do political wars and legal wars. I know how to do that. I was trained to do that. Been doing it for a long time. And so I just want everybody to know that we have that feeling in this community, and a feeling of fear also. Thank you, Mr. Chairman.
Back to the questions. So for the 2024 corrective action or action plan, what you guys helped develop that, right?
The hospital
The
developed.
hospital did
The
it.
trust simply,
You guys
yeah,
kinda
sorry, the
reviewed it?
trust simply asked them to look at those 4 and then what improvements could be made to.
Did you use their measurables, their action plan against the 2025 audit as far as what they're able to accomplish within
Oh,
their
measuring
KPIs?
exactly what
Yeah.
was implemented and what was not. Don't, not sort of term for term.
No, just the covenants basically.
Mhm.
Whatnot.
Really, the covenants being the source of, the covenants really being what the organization was evaluated against is what we stayed with.
Okay, so the corrective action plan that was created, they could have just created it and then just not followed it, and nobody, nothing at that point.
honestly, we don't know. It was a trust requested it and then it was provided and then we didn't follow it from
Who
from
would know
there.
though?
Hmm.
Who would know potentially?
I think the trust in the hospital would know. Or the hospital would know about their implementation, you know, where they are on the implementation of that.
So through this year's audit and everything, you were recommending another corrective action plan, correct?
I think that that's a way to it's a good tracking mechanism, right? When
Somebody
you're really
follows
trying
it.
to see if somebody follows it and you're really trying to see, okay, what's going to get done in
Kind
January,
of like a Bobby
February,
saying, "I stop,"
November.
or I'll say stop again.
Nothing like a checklist though, you know,
Um,
right?
Okay. No, that was it for me. Thank you. Anybody else have?
Mr. Chairman, thank you. Thank you, ladies. I appreciate all the work that you put into this. Checks and balances are always beneficial to everybody that's upright. It's always good to have somebody looking over your shoulder to make sure that you're doing what you're supposed to do. If you get nervous about that, then there's probably a problem. At least that's what I've seen in my lifetime. And I think it's good that we have an action plan that has shown everybody just exactly where we need to go and how we need to get there. And I do appreciate that being put together because this is one of the most discussed topics, is the easiest way that I can put it, in this community that I'm asked about. And I'm sure the other commissioners are saying on a regular basis. And having that checks and balances is important. And, you know, and I know Banner's looked at that. I know Collective Health Trust has looked at that also. And as long as we're moving forward and not moving backwards, that's a positive sign. And I do appreciate that.
Sure. I'd like to get a copy of the action plan from last year and the one for this coming year after it's prepared, and then I'll get that to our Memorial Hospital Board of Trustees. Thank you.
Any further questions for the ladies? Thank you very much for coming.
Thank you
Really
for
do
having us.
appreciate it and all your hard work with going over the covenants and all that stuff. Mr. Nelson? Please leave that here. It's only one working.
So, Mr. Chairman, Commissioners, I think that is the prepared presentation. I do know there are representatives from Banner WMC in attendance. If you had questions for them directly, certainly myself or Ms. Worthen from the Trust can answer any questions from the Trust perspective.
If it isn't, nobody has an objection, I'd like to hear from the horse's mouth from Banner. If somebody's available to answer that question.
I believe they are.
Try, anyways, yeah. Thank you for
Right.
coming. Good afternoon.
Good afternoon. I'm Margot Carson, and I represent the Western Region, and Lance reports directly to me. With Lance being out, Rachel, the Chief Operating Officer, is the interim right now, so we'll partner. In regard to the advisory board, what the fortunate thing is we do meet tonight. And Rachel did a great job. She took the audit. We did make progress, but it wasn't good enough. And so if you remember, input into Lance's eval was a deficit last year. That's gone. So we did work the action plan, and it's clear that we need to do a better job on engaging the community. So we're going to take that forward. Again, Rachel did a great job. She just took all the findings from this recent report, put it in an action format. We're going to present that to the advisory board and have them help activate tactics. And if they don't have any, we're happy to come up with some. And then what I'd like to do is have PYNA just look at it and make sure that we're true to every word of the covenant, in which we should have done last year. To the comment, how committed is the advisory board? Very. They're engaged. I think they appreciate the work and the time. I like the idea of maybe having some partial open meetings because they're there and it's already scheduled. So we certainly can bring that up as well as the frequency of the meeting. So we'll give them all this feedback and then help craft a vision forward that is more compliant with what's expected.
So to Commissioner Nicolason, my point for the corrective actions or the action plan, seeing maybe last year's action
Yeah.
plan as well as this year's
Yep.
coming up. But I'd really like to see like last year's, what measurables were accomplished, what
Okay.
ones were not. And you know, are you guys assigning those measurables? Are you assigning them to specific people so there's accountability, or is it just the overall, hey, this is what we need to do, or how do you go about that?
Yeah, I don't want to speak for Lance, but if you know Lance, he's very structured and meticulous. So I'm confident we'll find the action plan that he drafted. And then what we can do is just fill in what progress were made. And as you can tell, we need to do a better job at the community. But the advisory board is getting additional information that they had not gotten last year. So we certainly can show you where the improvements were made.
It'd be nice to if we were also in that loop, maybe.
Absolutely.
Mr.
Thank you, Mr. Chairman. Marco, thanks for making the trip.
Yeah.
My one concern is over the years that a lot of the physical plant remodeling and upgrades, some of the renovations weren't done, and we're a little ways past COVID, so I don't think that's the knee jerk
Yeah, no.
culprit. I think that the quality of that facility is critical, almost as critical as the people that
Agree.
are providing the services. I think that I heard that we're, making up some of the gap, closing the gap, I guess. Can you talk a little bit about some of those challenges over the last couple of years and how you've addressed or how you're going to address getting those actually accomplished? Because they've been allocated
Yep.
but not dispersed.
Yep. Thank heavens for Rachel. She's been our construction person.
Hi, I'd like to introduce myself first. My name is Rachel Bryant. I am the current Chief Operating Officer and interim CEO while Lance is out. And so as the Chief Operating Officer, I do oversee design and construction projects throughout the facility. And you are very correct, it is a very aging facility. And so things that we've been embarking on in the past couple of years is updating the plant. One thing that we have planned, and we're actually working with architects and construction firms now, is to redesign and update the central utility plant, which is updating the boilers, relocating and giving more room to our supply chain, which is critical to the operations of the hospital. Recently, as of last year, we did update our sterile processing department, which is the kind of engine behind the operating room, to make sure that everything is up to date and up to standard. We still have a few things left to do there. We're going to be completely renovated on all of the major components in that department will be done as of July. We have a delivery of a major cart washer coming then. We're currently renovating the oldest building on the campus, which is our north building, which is 76 years old. And we relocated the PEDS unit over to the newer West Tower. And we have built a new 7-bed unit to hold our psych holds waiting to go to WBI. So that is complete. And we have been given occupancy through the state inspection. So we're working on operationalizing that. We're also under renovation for our outpatient unit. So that is under abatement now. And then as well as our third north unit where our physician sleep rooms are, and we are expanding the current ICU by 6 beds. So we'll go from a 14-bed ICU facility to a 20-bed. Those are the major things. In addition to that, we are renovating multiple locations in our imaging department, our nuke med department, our x-ray room. We've already renovated our IR suite and both CT suites. We've also completed the renovation of a new EP lab that completed last May. And in 2020, we went live with a new biplane room. Also, for aesthetics and infection prevention, we are going floor by floor and removing all of the current carpet and putting in LVT flooring and renovating rooms one by one.
So I just wanted to thank you, Margot, for kind of our candid conversation earlier. Just to recap for the public, it was just a request to make sure that our physicians are, I guess, adequately compensated, and that we make sure that they could be part of this community. And I took it as a commitment to do exactly that, just to work with the physicians and work within Banner to make sure that we have good quality physicians here that can support the community. And then secondarily Banner has a lot of partnerships in the community to help raise all boats and make sure that quality is across the board with those different entities. Banner takes a black eye when some of your partnerships maybe are lacking. So I appreciate it, and any help you can be in that arena is greatly appreciated. Thank you.
Any further questions?
Can I add on a good note? So we do monitor quality every month, and we just were recognized. Becker's is a national modality that recognizes great organizations, and Wyoming Medical Center was just ranked top 100 community hospitals. And so from an outside entity in, we'll make sure we can educate about that. We're not perfect. I'm always sad. I'm a nurse by background. When I hear harm has happened, overall, the clinical quality is improving, and we watch that every month. So I just wanted to give you reassurance that at the facility level, at the micro level, we're watching it every month.
I have a question, Mr. Chairman.
Go ahead.
So what do you do when you get knowledge that some terrible thing has happened? Just turn that over to the lawyers, is that it?
No,
That's where it goes?
actually, I appreciate that question. I'll just say the emergency department has made an incredible effort to improve process down there. And so anytime we hear about a patient incident, the department gets together and we take a deep look on what happened and make improvements. And then we measure every month. I'll just share about the emergency department. They have significantly improved. They're not perfect yet, but that team, the physicians and nurses, have really taken it upon themselves to make sure when patients get triaged in, they're brought back quickly when we see the data. And that's what we do. We do not wait for attorneys. We always do, it's called a root cause analysis, to do a quick look back when harm happens, and then we make improvements based on that.
So the people that I talk to have told me that nobody from the hospital ever checks on them. Didn't ask them about, how are you doing without your leg?
Hmm.
And then it ends up in the hands of attorneys. And these people are frightened. And it may be that in this particular case, something happened. You don't go in for a back operation and lose a leg usually, but I understand that there are things that can happen that aren't negligence. And I'm not saying that there's negligence. I'm just saying you have people who are afraid and they don't know what to do. And they're sitting there in a wheelchair and they're on Social Security and they don't hear from anybody. Nobody says, gee, we're sure sorry, and is there anything we can do? That's the part that bothers me the most. I mean, we're all just human beings. We all make mistakes. We don't mean to hurt anybody, I don't think, in most cases. But sometimes people just walk away from it like they don't want to be bothered by it.
Well, we'll take that feedback back. I know our new chief medical officer gives his personal cell phone out, so we'll do a better job, and everybody deserves to be listened to and cared for.
I agree, but it isn't happening. It isn't happening. It doesn't appear. But thank you for
Dr.
coming.
Phil?
Good afternoon. Thank you for allowing me to speak. My name is Phil Stile. I'm Chief Medical Officer at Banner, Wyoming Medical Center. I moved here last September. The quality, patient safety, extremely serious. I see myself as the ultimate point of responsibility and accountability. I started a program whereby every time I receive a grievance, something goes wrong. A patient suffers harm or they're unhappy with the care received, even in absence of any wrongdoing or harm. I invite them to my office. I listen to their story, and I stay in touch with them. And I'm very sorry I'm not familiar with your constituents who have suffered, and I'm more than happy to reach out to them. And I'll tell you a story on how that can be scaled. You could say one person alone can't fix that, but I believe that with one conversation at a time and giving every community member, constituent, my personal cell phone number. What recently happened, I helped a gentleman who I didn't know was a pastor at the church. And I gave him 30 or 40 business cards and said, please give them to your community so they have a friend inside the walls of the hospital. And a couple of weeks later, I got a random 307 call I didn't recognize. There was a gentleman who was upset on the floor where his wife was receiving care, and I immediately went up. We resolved the situation, and I asked, with all due respect, sir, how did you have my number? He said, well, the pastor in my church gave all of us the number, said, when you have a concern, call Dr. Phil. I'm not a saint. I'm not here to heal this community by myself. I'm extremely proud of our team, of our commitment to quality, patient safety, patient experience. And we're at the turning point where we're achieving excellence, just being by a third party rated as one of the top 100 community hospitals is a huge testament to that.
Mr. Chairman.
Mhm.
So you must not hear about all these things. There's another guy lost his leg up there because he got an infection while he was there. I hear them all, and I've heard about you as well. And I could speak to you about that at another time. But look at me, look at my face. I'm concerned about these people, and I do talk to them, and I hear them, and they're frightened. And growing up here, all my family were born in that hospital. My kids, me, my dad and mother. Some of my family died there of old age. And so I have a different view of it than you do, sir. I know I can see you're a very highly intelligent person. And I hope that you do what you really in your heart knows you should do. That's the only thing I can ask you to do. Is follow your heart and respect my people. Thank you.
Go ahead, Peter.
Yes, sir. May I answer to that comment?
Mhm.
Thank you, Mr. Chairman. I fully agree with you. I've been a surgeon for more than 30 years. I was a trauma surgeon in major level 1 trauma centers for many years. I always felt if we don't treat every patient and family member on our watch as if they were our loved ones, we're hypocrites. And instead we are healers, and we're here to heal this community. I moved here with the intent to stay and to retire here. I love this community, and any member of your community who has concerns, I will be there for them. I will add that being a trauma surgeon, bad things happen. Bad things happen that cannot be prevented. Bad things happen that may be the natural course of disease. And I also know, having been a surgeon for 30 years or so, there's also very unhappy patients in spite of us providing highest quality of care, and I respect that. But would love to meet with those constituents, understand their story, be here for them, and I fully agree with everything you said, sir.
I believe you. Thank you.
Thank you.
Commissioner Nicolason.
Thank you, Mr. Chairman. You know, in summary, Margot, you've got a really good chief medical officer, and I think you've got some really good people. And I think you're lucky to have Dr. Phil, and I think you're lucky to have a lot of the other physicians and nurses, and down to the techs and the maintenance people. You guys have made some improvement over the last 4 years that I've been on this commission, and I am proud of being just a little teeny part of that. So, please be committed and working with the Collective Health Trust to continue to improve healthcare, because you're critical to Natrona County, and we're kind of an isolated community and need you guys to be performing at an A level. So thank you.
And with that, Dr. Phil, thank you for being part of this community and showing up here. Margo, thank you for traveling and coming
Always.
in. And your whole team, thank you for stepping up while Lance is, being Lance. And the whole team, thank you very much. A lot of good information. There are concerns, but it's a work in progress. As things come up, you work on them and fix them. So thank you.
Thank you so much.
Thank you.
Director Nelson, do you need anything else? I think we've heard from pretty much everybody, so we're gonna move on to the next topic. We're a little behind. Sir. I don't see where Tom left. Tom left. Nope, he's gone. I don't see Tom. I don't see nobody. No Tom. Plus, it's not in the agenda. Nobody made a motion to modify the agenda. I'm sorry, what?
I've got a question. The county created a big problem for me and I need to figure out how to clear it up. And I hope you guys can help me with it.
With what?
Okay. I've been trying to put a trailer house on my yard, which is way big enough for 2 trailer houses. And I've got one on it with one of my granddaughters living. I tried to put another one in. First place I went was to get the permit. They told me that I had to go get the health department to okay a septic system in that yard. So we did that. So I got Dave Scribbins to engineer a leach field and give it to the Board of Health. It was declined. The DEQ got involved some reason because my yard is close enough to Mills's water source that they had to be careful of what went into it. So a new design was done by an engineer that I paid for all of this. And the septic system that was engineered, the only ones that knew it was DEQ. And so it took me forever to find the thing that you put in a leach field where the sewer goes underneath. Now they're tubes with a wrapping around them and they lock together. So after I get everything cleared with the health department, and then I go to the county to get the building permit, then I can't put that trailer in my yard because I'm zoned light industrial and they won't. It's plenty big enough, but they won't let me put that trailer in there. How am I going to correct it?
And you've talked to Sabrina and
I've
planning.
talked to everybody. The only thing I could see that might help me was come talk to you guys and see. I know for one fact if I'm zoned light industrial. If I take that and make it urban livestock or urban residential, then I can do that, but I lose what the yard is already designed at as a.
So can you do me a favor? Go talk to Sabrina again. To Sabrina with planning.
Okay, I think that's who I have been talking.
Okay, talk to her again a little bit. Let her know that you talked to us and we need a solution if at all possible, okay? And then, yeah, that's good. And that you've talked to all of us. I'll chat with her as well. Right now, sir, we have an agenda that
I know.
we're like 15 minutes
I'm
behind.
fine.
No, it's fine. You got a problem and we need to kind of try to address it, right? So if you go talk to her and then I'll talk to her after we're all done here or tomorrow, and then we'll see what we can do, okay?
Thank you a lot.
Chairman,
Yes.
I would just say Sabrina and I have been emailing. She informed me about this during our meeting. We think we have a solution, but she can talk to them about what her and I was just emailing back and forth about.
Okay. Sounds good. Thank you.
I make a motion to amend the agenda so that the Central Wyoming Fair and Rodeo folks are here to give you a 5-minute statement.
Denied. Okay, the motion is second. Go ahead. All those in favor say aye.
Aye.
Fine.
He
Just
picks
have to
on
have your
some
way.
people and he's kind to others, you know what I mean?
Thank you. It's like liaison.
I know, right?
It's true. Glad to see you're here.
Thank you.
What you got for us? Ticky tock.
5 minutes.
For one thing, we thought we should keep you apprised of things that we have in the works.
We are approaching a new time, and since Wyoming Fair and Rodeo, we're trying to upgrade ourselves to look like some of the bigger outfits. So we've had drawings rendered of a whole new chute, refab, and get rid of the old rodeo office, which has been there since 1952. So I have pictures of it that I'd love to see, love for you to look at. We're gonna have posters made and put it out during our fair and rodeo for people to look at and comment on and see what kind of interest we've got from the public. We think it's something that's much needed. We looked at just refabbing it back there, but everyone that came in and looked at it said that anything that we touched, it doesn't meet code right now, so it would be a tear down. So that's what we're up against, the total tear down, to refab and remodel everything back there and bring us into a new century.
Are you gonna leave that picture here?
I'm gonna leave this whole thing for you.
Like to get that on YouTube if we can, so the public can see it.
You bet. And then the other thing is, we've talked about replacing our billboard replay screen across the arena where everybody can see it. It's getting so old we can't hold the board on it. We're looking at putting in a digital board over there. We were gonna try and have it in this summer if we got approved on the budget, but we talked to them this morning, it's an 8-week order and 12 weeks minimum before we could even get it here and get it put up. So even if it got approved and I could order it today, we're still looking at just before the Indian relay races before we get it up. I think it's something that's much needed. We can sell a lot of advertising on it. We've already got interest in it. It's a self payback. Will it pay back in the first year? No, but it will pay back in the first 3. So if you gave me a tentative approval that it's gonna be approved on our budget, I can order it. I talked to the gentleman this morning. We can order it without any money down and just pay for it when it gets here, and he can start it in the works to where we would have it in before the Indian relays.
That would be great. Let me ask you a question. My wife told me she was visiting with some rodeo people from somewhere, and in their arena in the summer on those screens they play movies, old time movies, and people come in there like they're at a drive-in movie and watch movies.
We could do that. We talked about it. Yes, it is possible, and we do have the capabilities to put it on there.
Fantastic.
So we could open concessions and do drive-in.
And it's 200 grand, right? Am I right?
Instead of drive-in, it'd be sit-in theater outside.
It's 200 grand?
200 grand, 207 will get it installed. That's buying the screen and installing it, about 207.
Well, we'll hopefully, Mr. Chairman, we'll take that up and have a vote on it. Do we do that here or wait till the big meeting at 5:30? He's giving me the evil eye.
Again, we're asking if there's any chance it's gonna be approved on our budget that we submitted, where we could order it and have it in by the time to get it for Indian relays.
There might be a chance you could get it now.
No, it's an 8-week build. We called them this morning.
Would you have it if we did it now? Would you have it for the Indian
Yes,
races?
if we ordered it today,
So we could put it in use this summer and get it rolling?
we'd have it in use by the middle of September.
All right. I don't have anything further. Ms. Drew, do you have anything to say?
I don't have anything, but we appreciate you making time on the agenda for us this afternoon.
You're welcome.
What are you turning all red for, Tom?
I'm not. So thank you for listening to our presentation and letting us have time. We appreciate it.
Thank you. We'll take it under advisement.
Thank you.
Mr. Chairman.
You can go ahead.
Just kind of a straw poll thing. Is there anybody concerned about that aspect of the fair's budget, proposed budget? Because I'm personally not concerned about that particular aspect of the fair's proposed budget.
I'm not either. It looks good for you, Tom.
Taking under
I'm
advisement.
not signing the papers until it's approved officially. Otherwise, man, I'm not gonna get stuck with 210,000. No way. Thank you though.
Yeah. What should we do? Can we put it up for a formal vote?
You can.
I move that we approve 210,000 to the fair board for this big screen.
Where are you getting them at? Okay, go ahead. Motion. Do I have a second?
Second for discussion.
Motion and second. Open for discussion. Where are you getting the money, Dallas?
Tracy, where would we get the money? I called her earlier. She's the one who knows. She needs an invoice that she holds. I'll let her explain it though. She's better at that than I am.
Mr. Chairman,
Go ahead.
since we wouldn't have to pay until after it's here, 8 weeks.
Mhm.
8 weeks, Tom, is that what you said? 8,
12.
12. It during budget hearings that start Friday. The budget will be approved by the 3rd Monday in July. So we still have time to cut a check to figure out where, and also figure out where the money would be coming from. Sir,
We can order that right now. All we need to know is it's gonna be.
Okay. That's what you're asking for is just approval next year's budget. Okay,
Mr. Chairman,
go ahead.
Tom, so that is currently in your budget request if I remember correctly, yes? Okay, thank you.
Any further discussion? So there's a motion and a second for what's your motion again?
Let's slightly amend it to approve the budget for the request made so that he can get the thing ordered and he knows that he's going to get it paid for.
So your motion is for a specific approval of his budget as far as the
The 200.
Voltron extraordinaire TV thing. Okay. So you kind of amended it, so the second. You feeling that?
Yeah. Friendly to the amendment.
Okay, any further discussion, Dave? You have discussion?
No.
Peter?
Mr. Chairman, just for clarification, this would be an approval of the $207,000 line item in the fair's budget for the coming fiscal year.
And that's it. No other parts are being
That's the
approved.
motion.
Yes.
Okay.
Okay. Those in favor say aye.
Aye.
Opposed? Order your stupid TV.
Go get that
Tom.
TV and get that in there tomorrow.
Thank you very
I
much.
want it done by the rodeo.
Probably not gonna happen there. Uh-huh. Still red. Okay. And we're running behind. So, Liz, sorry, but
That is the Liz Becker.
somebody gets impatient here.
No, she's a city personnel who I think is a great person. Does a lot of hard work for the city of Casper.
to council a little bit later. Enjoy having time with you. I know.
Are you gonna be nice to us, Liz?
Very nice.
All right.
Doing just a quick, just a quick recap really of the year of transit and, no changes to the budget request. that we had from last year. We've kept everything even keeled. Just, I wanted to get that out in the air, but, I'll be official now. Mr. Chairman and Commissioners, Liz Becker, Community Development Director, Transit Director for the City of Casper. The Commissioners cover in the past the cost for our assist or our door-to-door service. And the back page is what we'll eventually get to. And you all are flipping through there, so I'm just telling you right now. With Exhibit A is a recap of the rides on the assist, which is again door to door. Typically, over the last 30 plus years, you cover the cost for assist rides in Evansville, Mills, and Casper / the county. Bar none pays for their own assist door-to-door service. And the city of Casper, the city of Mills, and the town of Evansville pay for the the fixed route services that we have with the 6 colored routes as we have throughout town. So that's kind of the high-end overview. What I wanted to do though was to step through some of our accomplishments over the past year. Kicking off with, on the agenda that I put together with this first page, is that we celebrated our 5th anniversary in operation. The city of Casper assumed operations on May 8th of 2021, and we celebrated the 5 years on May 8th of this year. We had extended invitations, and I know the Commissioner North had shared, you all were all out at the Hell's Half Acre reopening, which was wonderful. And it was great to actually to have that wonderful county asset back in motion. And so we had a great turnout. We had not only city staff, we had other representatives from the transit operation, as well as riders that showed up for the actual 5-year anniversary. I attached the press release that we had put together for your just reading even after today's meeting, which just again recaps what we've accomplished over the last 5 years. Again, we serve over 160,000 citizens annually, but we have done a lot over the last 5 years to usher in, as I said, new technology, and to do so from a safety standpoint as well as a communication standpoint with our ridership. We have cameras and notification systems on the fleet. We are investing in an announcement system so that everyone can understand when the rides are, where the stops are. That will help from an ADA standpoint for our ridership also. And we have a very strong relationship with FTA, who continues to fund us the majority of our budget. The majority of the budget, of course, is personnel. Relationship with the Casper MPO. Again, we are fortunate in Casper, as is Cheyenne, that we have the ability to have a transit operation because we have a metropolitan planning organization. Our representatives on that, again, you have Mike Hagler, who sits on the technical committee and really handles the details of planning with the plans that serve the entire MPO area, which is most of the county. Then on our policy committee, Commissioner North is our representative that represents the county. And I know, again, Coates has also been at several of the meetings too, and we do the updates on the projects. The staffing right now, my manager is currently at the state transportation meeting, which is here in Casper, Y-Trans, so he was unable to join us. Our supervisor is James Cochran, and he is running the operation now over on 4th Street. And then we sit with the count on the dispatchers, drivers, and administrative assistants that I've outlined there. Again, I shared our annual ridership estimates at 160,000 and how that's broken out by the door-to-door versus the fixed route. Our budget forecast for fiscal year 27, we have remaining the same as we did with last year. Obviously, we have seen some increases in the last few months with fuel, but we feel that we've got that covered. Insurance went up significantly. I don't know how it is with county operations, but insurance was a bit of a spike, but we again were able to manage that by bringing down some of the operational line items to help cover that overage. And so the contract I've attached in a draft form, And we will, after today's meeting, get it finalized and sent to your county attorney. Updated, I highlighted the yellow areas of the terms of service, which is again for the assist service. The performance is for 1 year. And again, the compensation remains the same as it did from last year. The invoice for fiscal year 26 was sent to Michelle, and that again, you all had asked for by June 1st of each year. The accomplishments I recapped on this agenda, we are looking at 2 replacement vehicles. This year we have our transit asset management plan that keeps us up to date on when vehicles need to be replaced. Typically it's 7 years and about 250,000 miles per bus. We did implement a fare increase a year ago, and we have not seen any form of a dip with our fare revenue. We've seen consistency as we had not had a fare increase for 20 years. We are currently doing a route analysis, and that's particularly important. We have done a lot of outreach. We'll continue to do so. And again, completion is estimated this fall. The route analysis is done every 5 years to look at which stops are worth keeping, which ones need to be removed that we don't have ridership on. But from interest to you all, we're really looking at taking some of the fixed route out to the airport a couple times a day, corresponding with the air service arrivals and departures. We're also looking at potentially running a route out to CRC in order to get some of the folks back into town to get reemployed and to get to appointments. And so we've been working on that along with the VA. So we'll head east. We want to pick up more of the hospital facilities out on 2nd Street, not only the VA, but picking up Summit as well as the other banner operation that's out there. So, as well as oncology, we've had citizens come to the city council meetings that really want to see fixed route out there. So, north right now, again, bar none is only served with assist. But from a county perspective, I think I wanted to share with you all the east-west opportunities for expansion. So that's coming out through the route analysis and the public surveys. Y-Trans conference is in Casper this week. Our team is teaching the Transit Safety Institute training for drivers around the state. We have 2 of our drivers that are certified as leads. Our team has undergone CPR training this year. And we also have a TSA training planned for this summer. We have partnered with the Department of Homeland Security and are looking at ensuring that our fleet is, that we're conscious that there is no concerns from a Homeland Security standpoint related to our fleet and our operation on wheels, and that our drivers are very, very conscious through this training for safety, not only for themselves and their riders, but also the community as a whole. We operate 22 fleet vehicles and will continue to do so. So again, the attachments are the press release that went out about our 5th anniversary, a draft of the contract with the highlighted components that I think are the ones that are changing from last year. And then again, the final page breaks out the costs that we kept at $8.14. Pardon me, let me get to that one. We wanted to, again, keep the consistency, but the cost per mile for the assist door to door is right at $8.14. That covers personnel. Drivers are kept at the same rate as they were a year ago at $22.21 an hour, but that also covers the cost of the maintenance to the assist vehicles only, not the whole fleet. We separate out the cost of maintenance to assist and then a fuel to cover the $8.14 per mile. So, but other than that, numbers are pretty much steady with what we had a year ago. So I'd be happy to answer any of your questions, except from Commissioner Laird. So the rest of you, from the other 4.
Commissioner Nick Lason.
Thank you, Mr. Chairman. Thank you, Liz, for being here.
Yes.
Can we turn to Exhibit A, last page? How did you come up with the $8.14 for the cost per mile for the assist program?
Again, that is looking at the cost for the driver. And again, with the assist service, we look, the mileage that the drivers have, again, on a daily, monthly, yearly basis. So looking at what the average cost, well, not average, what the cost of their payroll is at 22.21 an hour. And then again, looking at the fuel, the average fuel cost for the assist vehicles during the time that they are operating, we're 6:30 to 6:30, as you see in the contract. We also run the assist on the weekends, but again, it's a shorter amount of time on Saturdays, typically about 7:30 to 3:30. And then, so the maintenance as well as the fuel.
Just for my own clarification, are you adding
Commissioner
some?
Laird, I'm not quite
Oh, sorry.
Thank you, sir. Okay, turning to looking at math,
Yes.
which is not my strong suit. On Exhibit A, annual cost of the program is $193,000.
Yep.
The FTA grant is 50%.
Yes.
So that brings it down to the cost of the program, $96,000.
And then we have the Black Cat grant through IDOT.
The YDOT 77%, the match cost brings it down to 74,000. If the county contribution is 23,000, I came up with like 17,000 rather than 22,000.
And how did you do that? I subtracted 96 minus the 74.
Well, 74. I had 74,000 times 23%.
Okay, so we looked at what the match cost is for, we have a 50% match on all fleet vehicles through the FTA. So that doesn't matter if it's assist or a
Well,
link.
let me just, because I know you need to get back over to the city, but if the cost of the program is $74,000 after these grants,
Well, yes.
then 23% of that's 17,137.
Okay, I don't even have my calculator with me, Commissioner. So on the 77% is what the Black Cat picks up, and so the remaining 23% is what we are asking the county to pay off of that 96,000. So are you saying you did on 96, 769 or 770?
No,
23% of that?
No, I did 23% off of the $74,000, the match cost.
Okay.
But if it should be the 96,000.
Yes.
Okay, then the math is right.
Yes. And I really did double check that, Commissioner.
Okay, thank you.
Even if it's not our strong suit, but I did really double check that.
Liz, thank you for coming in. Can you tell us how far you go west in the county? Is that still Bessemer Bend area or?
Mr. Chairman, Commissioner, yes. We pretty much, Bessemer Bend is where we probably have the last of the assist pickups right now.
What about to the east?
The east, really, it's Evansville and probably Coal Creek.
Okay.
But not any further than that.
Oh, okay. All right. Thank you.
So just briefly, I did reach out to Summit and they did express an interest in having, access for a route out that way. So
Perfect.
I will touch base with you later on and work the
Yes.
particulars out with you on that.
We want to definitely get their responses into our database. Yeah.
Okay, fantastic.
We have a great consultant doing this project for us, Farron Pierce, and they've just been very committed and in town a lot.
I wonder if I got a question. Go ahead.
Nice to see you, Liz. I know Liz for a long time. I was on the board for the city council, and she did a great job then. She does a great job now. Did you add new routes to this year or for the following year? Will there be new routes for the buses?
New
where they
routes.
go different places
There are
and
new routes. I'm
routes.
sorry, routes.
I'm
That's what I was
sorry.
like. Routes, ROOTS, routes. Routes, I guess that, maybe that's
I'm
my.
from North Casper.
I was
That's
just
what they
gonna
taught
say,
us then.
I'm from Texas, so I guess we're routes. Okay, so have we added any? No, we are doing the route or route analysis right
Same
now.
thing.
And at that
It's
point,
like
we,
crick or creek, right?
right,
Okay.
oil or ore. So from an implementation standpoint, I would anticipate we will get these with the study completed in the fall. We'll have the 30-day public comment, and then the policy committee members would vote for this. So we would probably see implementation in January.
All right. Thank you
to
very
get
much.
New routes out there.
Thank you very much.
Okay.
I'd never have argued with you in my life, and I don't intend to start now.
Never. Okay,
Any further questions?
we're good.
We're good. Thank you very much.
Thank you all. Have a good rest of your meeting.
Sabrina?
Want me to get us back on time?
No, not on this one, probably.
Thank you, Mr. Chairman and Commissioners. Our attorney, Ashley, and I have discussed industrial parks with Prometheus and want to know guidance from you all if this is something you're interested in pursuing or not. We sent a memo, basically according to state statute, since we have zoning in Natrona County, we are able to create an industrial park for purposes such as the data center that's in the power plant and man camp that's proposed to potentially come to Natrona County. Laramie County has created industrial parks. I've spoken with them. I have have a template from one of the ones that they created. Uinta County, I'm not positive on what they're doing. I did reach out to them, haven't heard back from them yet. So I don't have any information on exactly what they're doing, but kind of just a question for you guys and what direction you want us to go, if this is an option or not.
Commissioner Coates.
So I don't really have a lot of interest in doing industrial parks. I really like the industrial siting process. I think it gives a more robust, I guess, entity the ability to scrutinize projects where I don't think our county has the ability to scrutinize them to the level that projects such as data centers require. So for me personally, I don't think we go down that road.
Commissioner Nick Clayson.
Thank you, Mr. Chairman. I agree with Commissioner Coates. I think that if we had maybe a design where these are in a designated area consistent with our zoning, but if what we're saying is these could be anywhere, whether it's a RAM district or, you know, right close to the city of Casper, I just think that it is maybe getting us into a place where we don't have the competency and expertise. Can you give, there are a couple people here that I think are interested in the latest on the Prometheus data center. Can you give the public an update?
Mr. Chairman and Commissioners, no, I cannot because I don't have one. We met with them back in April, I believe it was, might have been the end of March. And we've had a couple conversations throughout the time, but this is kind of our first step, was getting in front of you all and seeing kind of what direction they might choose to go, depending on your support of or not with an industrial park. And you're correct, we would do it under the PUD process. So essentially it could be wherever it was approved by you all to create that PUD, wherever it was created. It's an overlay district is what it is.
And Commissioner Nicolason, I did talk to their attorney last week because she was asking about the PUD stuff. I told her that we were presenting it to you all and that we would reach out to her after Sabrina and I had direction from you guys Because I thought that it was a little premature to kind of go any further until we found out whether this was going to be something that you all wanted us to pursue.
Mr. Chairman, it is possible for the county to participate in the industrial siting process as a party, not just to the impact assistance funds, but to the siting of the thing, everything from the micro siting to whether we want it at all. So just there is that opportunity, and some counties have over the years said, this is what, we need. And this is what we don't want. So there is that opportunity for us to have a seat at the table other than just asking for fire trucks and, overtime pay for sheriff's deputies.
Commissioner North.
Thank you, Mr. Chairman. I think there's a benefit both ways, but I think we need to have details before we make any kind of decision or move forward on anything. My understanding is that the data center would not actually be in Natrona County, that it'd still be looking in Converse County. And so, as far as I'm concerned, we need to know more definitive information as far as what things are going to be, what they want to put in Natrona County, where they want to put them, and what the controls are going to be. And I think that's something I've got mixed feelings about the industrial siting committee and the way that works. I think this does provide an option, but I think you have to have all the information before you move forward either way. And I don't want to be in the same boat that Cheyenne is, where they're making these big blanket areas. And I think that's something that we need to be very specific about what we do and have all that information ahead of us before we even evaluate it.
Mr. Chairman and Commissioners, the conversation that we had with them was that the data center would be in Converse County and then the power plant and the man camp in Natrona County. That's the only thing we've ever been told in our department. So that's the information that we have.
And I think at this stage too, Sabrina and I this isn't just for this project, of course. This is, do we want to go down this route to look at amending and putting this in our PUD regs? And so just keep that in mind. It's, I understand that, yes, this project is really what brought this forward a little bit. Just like anything with our regs, there has to be a reason for us to actually first start looking at it. But this is to say, do we just want this, to have this option for any of these projects that are coming forward in the future?
Commissioner North.
I'd like to know something. I always am concerned with what our constituents think. How many people are against putting in a data center? How many people are for a data center? Okay, thank you. My comment is, I hope you can help that elderly gentleman that was here. Did you see him shaking like he was? He's scared. And I hope we can find a way that he can get both of his trailers on his lot.
We're going to work on that.
Thank you. I know you will, and I appreciate that. You're a great employee for this county. Thank you.
So I think PUDs, there is a benefit of using them when time is right. I do not know if I don't think, depending on the time frame of how fast or what this project goes through, the one that is highlighting the PUD, whether it stalls out at all and you become if you become chaff to the political wind, or if potentially the siting will give a more accurate or potentially objective platform to talk about the project. The county still has its say, both within the siding, but also here in front with planning and zoning. I don't know if the PUD is proper for this project in particular. From what I've seen of other PUDs and been involved with building on them, this is a little bit different. Usually it's a group, not just one project. So yeah, I don't see a whole lot of support for the PUD.
Okay. That's what we needed to know.
And if you would take a look at, see what he needed for those two trailers, I'll get in touch with you tomorrow.
So we found out about that yesterday, and I talked to you about it, but we since changed a minor thing.
His business doesn't need to be in front of everybody.
Yeah.
I'll talk to you tomorrow.
Do we need a vote or anything? Do you believe that?
No action.
No, we're just good. Okay. Okay. Thank you.
Alrighty, Ashley, we're still behind.
Well, on a plus side, I don't have a whole lot for you guys. For a legal update. So we received a couple of the East End Road easements back. Still waiting on several more. We've been, handling the Title 25s as they come in. Also been doing some records requests. They've been coming in pretty consistently, but they were fairly minor requests. We finished the end of the year, fiscal year contracts. As far as I know, I had reached out to all the departments, and asked them to get them to me. So if there's any ones that we missed, then they weren't given to me. And so those are on the commission or the agenda for today. I'm meeting with some of the other departments, making sure things aren't falling through the cracks. Had a meeting with the health department last week, just to catch up on some things that we needed to address. And then we got a petition for a road easement vacation, and that's also on the agenda. Any questions?
Mr. Chairman, I have a question for people.
No. The treatment court, did we get that on the consent in time?
I thought I saw an update.
I'm blind though, I'll admit it.
I'm not seeing it. So we would need to add. No, not that one. So I think we would still need to add it. Unless I'm like you, it's there and I'm not seeing it. Yeah, Commissioner or Chairman, I am not seeing it at all. Tracy's looking into it right now.
Okay, thank you. Anything else? Can your comment wait till commissioner comments?
People that raise their hands that don't want it, I'm assuming that it's close to your own property. If it's not close to your own property, I guess you would have a different opinion. Is that true? I'm just trying to get a feeling for it. There's nothing we can do about it right now anyway. I had to delve into even what a data center was. And so the one way I came up with explaining it, I talked to a guy that's a friend of mine that's heavily into that. He says, "Do you watch Netflix?" I said, "Yeah." He says, "Well, it comes from a data center."
Oh.
So a lot of people don't know that. I know there's 6 of them down in Cheyenne, and they put a moratorium on them. My good buddy Elon Musk says in about 8, 9 years, they won't have data centers here because they'll all be in space where it's cold and they won't have to bother anybody's water cooling them down. That's a little while off, I guess.
16.
Anyway, thank you very much.
Okay, so that tally of the update basically.
Yes.
Yes, Mr. Chairman, I had one regarding potential litigation.
Okay. The other reasons?
I think that we should talk about.
Okay, so do I have a motion to go into exec session?
So moved.
WS for
So moved.
64,405.
So moved.
Second.
Those in favor?
Aye.
Outstanding. We'll be back.
Casey.
You might need it for something. Hold on to it, Ray.
I've already signed it, 7,000.
I didn't have to sign hardly any.
No, can't hear anything. That's why I said up front, so I couldn't hear it. I can't hear anything you say.
What was the motion for?
Good, sure.
That, during, declaring an adjournment, executive session. Executive session.
It's just all garbled.
Yeah.
You guys hear it?
Right now, he said there's no reason to go ahead with our planning funds. Planning and development, there's no need to go ahead with any plans in that matter at this point. You can still leave your comments since you're here.
Not that stupid. We're just gonna see what happens. Put this by this last time. Put the states. Every question I've asked, I've got the different.
Well, specifically that, because they're already doing, they've got their own guy, and he's doing some really weird shit. Well, they're general manager, they're paying for their warm stuff anyways, and talk to Danielle about it a little bit if you would. All right, we're back in session. Out of exec. No decisions, no actions were taken, just a lot of chitter chatter. You know how Dallas is. So that's it. We'll can you hear us now? Outstanding. So we'll take a few minute break and come back 5:30.
I just saw this note on my phone.
Alrighty, if we could find a couple of commissioners. Found one. There he goes. Okay, we're back in regular session. It was brought to my attention, maybe some people didn't hear our lack of action, no motion, no anything for concerning the PUD industrial park discussion. PUDs are beneficial and great tools pending the right project, but we didn't decide to do a PUD. We didn't decide not to do a PUD. It's just no motion. We took information in and that was it. So just in case anybody missed that. Oh, approval of consent agenda. Do I have a motion?
Second.
Motion and second. Those in favor say aye.
Aye.
Any contracts or agreements, resolutions that we need to take care of that you know of? Our boss isn't in here, so I don't see anything. Public hearings. I now declare a public hearing open for the consideration of resolution 21-26 transfer of funds. Hearing will be conducted in accordance with state statutes, rules of the Natrona County Commission and other applicable laws. May we have a report from Madam Clerk?
Mr. Chairman, Commissioners, for your consideration is Resolution 21-26. You will note that there is a proposed transfer of $364,084.10 from unanticipated revenue to the various account lines that are noted in the resolution. This basically pertains to a lot of reimbursement from WARM, our insurance company, for vehicle damages, and also a big portion of it is for projects and grant funds that come through the sheriff's office. In addition to that, we have a transfer of $682,842.13 from the balance sheet cash reserve to various account lines, again noted in this resolution. The majority of this amount is to go to the health insurance payroll expense accounts to cover the 4-tier funding that we went to for health insurance. And with that, I will stand for any questions.
Any questions? Madam Clerk? Alrighty. This time I'd ask those individuals who wish to speak in favor of consideration of resolution 21-26 transfer of funds to approach the lectern. Second call. At this time I'd ask those individuals who wish to speak in favor of consideration of resolution 21-26 transfer of funds to approach the lectern. Third call. Ask those who wish to speak in favor of consideration to approach the lectern. Seeing none of those. This time I'd ask those individuals who wish to speak in opposition to consideration of resolution 21-26 transfer of funds to approach the lectern. Second call. At this time I'd ask those individuals who wish to speak in opposition to consideration of resolution 21-26 transfer of funds to approach the lectern. And final call. At this time I'd ask those individuals who wish to speak in opposition to consideration of resolution 21-26 transfer of funds to approach the lectern. There being no one or others to speak for or against consideration of resolution 21-26 transfer of funds, I now declare public hearing closed. We have a motion.
Move, do we transfer the funds?
Do I have a full motion?
Make a motion to approve resolution 21-26 transfer of funds.
I have a motion. Do I have a second?
Second.
I have a motion second. Those in favor say aye.
Aye.
Those opposed? Motion passes. Alrighty. I'll open it up to public comment. Don't everybody rush it at once. You would? State your name and where are you from?
Well, Chris will, live east of town.
We'll need to turn that on. There you go.
Green light.
Good.
Chris Hool. I live east of town. Born and raised here, 61 years old. I've heard the comment by Prometheus on a podcast that there's nobody that lives out near where this project is going to go. I think I gave you all a map that kind of shows how many residential people live out there, and it would affect all of us. It just, I'm glad you guys didn't move forward with because I think a project this scale should go in front of the ISC. There's just too much involved. They're trying to push it through too fast. These are being built too fast. But that's about it. I had a lot more, but since you guys, didn't move forward with it, but if you guys like reading this book called The Crazies, it's about the guy that owns the property that wants to do this. And it shows what type of person he really is. So, thank you.
Thank you. Anybody else want to make a public comment?
Good evening. My name is Sarah Collins. I also live out there. When I say out there, east. And we're in between Glenrock, and so we're right on the county line. So it's really funny because our address is Evansville, but our septic and our well is Converse. So it's like this weird invisible line we get to live on. But I have two little boys. We have two little boys, and we also have a livestock business out there. And so I'm grateful to learn your guys' decision. But I just want you to hear the complexity of this situation, that it's not just a couple of residences. It's kids living out there. So we're talking about traffic on that Glenrock Highway. We're talking about wells. So when we're talking about the actual water aquifers, that's obviously going to affect our aquifers for our livestock business where we raise sheep. And it's a big deal. We raise club lambs and we raise butcher lambs. So this is livestock. I'm a 4th generation rancher, so this is very important to me. So I'm super grateful that you guys made this decision, but to hear the complexity of the situation, it's not just a couple of residences, it's an entire neighborhood. We actually just did get served. I'm going to just throw this in there from the sheriff about not being able to shoot our guns, which I have a sharpshooter little boy, and not able to shoot our guns because we are considered a residential area, because we are a subdivision. So if you want to get complex, we just got served, all of us got served from the sheriff that we can't, because we are considered a subdivision. So if you want to hear more about that, I can go into that as well. But I thank you, and I appreciate all of you guys being here tonight.
Thank you. What, ma'am? She said.
Go ahead.
Okay, next.
Can I have a copy of that?
Gentlemen, thank you. Thank you for your time.
Name and
Thank you
address,
for being
please.
commissioners. I know it's
Sir.
not a great fun job, is it?
Need your name and where you live, sorry.
Name and
My name is
address.
Brad Eisner. I live, I'll be in the shadow of this on Pierce Court, right across from the Hools. I can't tell you what a travesty I believe this is. This is going to impact us severely. My little house I bought it right. I had some equity in it. As soon as this goes through, I will be upside down. I will be paying for a house in my retirement instead of letting my house pay me. That's how much this is going to affect our property values. It's going to affect the water. It can raise the temperature in our neighborhood by 18 degrees. So if it's only 95 out, we'll think it's 115 because of the heat this thing is going to produce. The water it's going to consume, it's going to be on a loop. We're going to just get the water and we're going to just keep reusing it like the radiator in your car. I have to take the water out of my radiator. And my radiator's leaked. I don't see anything that they've said about, and I think it's only fair to put a big chunk of money. They're talking about spending 20 to 30 billion. What happens when this fails? What happens when their man camp sewage system fails? What happens when their well fails? What happens when their 10,000-foot well undercuts everybody in this room's well and we don't have any water? We certainly can't sell our property without water. I mean, there are so many impacts. The continuous low frequency, this thing will hum and it can be heard 2 miles away. It's caused farm animals not to reproduce, this noise that this is going to generate. They're going to build a power plant twice the size of the one we have. But that's 5 years out. In the meantime, they're going to have portable generators running enough power to power this structure. 2.5 million square feet. To put that in real terms, 5 Walmart supercenters, 4 stories tall, right down the valley. When that leaks, where's it going to go? Oh, Big Muddy Creek runs right through it, right behind the Hills property, which runs right on the Platte River, a quarter of a mile down. We have asked for their plan. They're going to spend $20-30 million. We don't have a plan yet. We don't know where it's going to be. We're not sure. Come on. You don't pony up that kind of money and not know where it's going to go. There's a plan. They're just not willing to share it with us. Everything they've told us has been sketchy. We had a meeting. They were going to tell us about things, and the only answer I got was, I don't know. We'll get back with you. We're not sure. Nothing concrete was gained from that meeting that we had. And that meeting was to explain what's going to happen. I haven't been told anything yet that's positive for our community. Gordy will make millions. The projection is 1.3 billion a year this will generate for him. We'll get, they're going to help us out. They're going to give us 2 fire trucks because they want fire trucks to be able to put out their buildings when they catch on fire. They're going to do some work in the city park in Glen Rock. That's pocket change to this guy. That's not coffee money to this guy. That's a joke. Oh, we're going to help you with your county park. But jobs, there might be 100. I can employ that many people at Sonic. I mean, they're not bringing jobs. They're getting tax exemptions. They're getting sales tax exemptions. So they're not bringing us anything. They're just going to take our property, devalue it, pollute it, air, water, noise, light pollution. And there's going to be 600 people in a man camp that's going to be right across the road from my house. That'll be a beautiful sight. Where they're going to get the sewage? Where are they going to get the infrastructure? Who's going to pay for all the police, the fire, everything that they need? It's people in this room. And they're giving us nothing. I couldn't be more livid. I couldn't be more against this. I don't know how to tell you how badly this is going to affect the people that are sitting behind me. Except for the ones in the very back row, they're going to become multi-millionaires. Thank you very much for your time, gentlemen. I really appreciate you.
Thanks, sir. Anyone else?
Yes, please. I'm Betty Mosley, and this will basically be in my backyard. I'm going to try not to cry because this is coming from the heart. I wasn't expecting to really say anything, but I've been riding back there on the ranch. I'll call it Lone Star because to me it was always Lone Star Ranch for 25 years. Riding my horse back there. We've helped them with brandings. We've helped them move their cattle, and I still ride back there every day and I check their fence lines. And when they have calves out there, I keep an eye on their calves for them and report I've run off poachers. I have been very blessed to have permission to ride back there and have that opportunity to ride back there. I love the prairie. I love riding back there on the prairie. I ride back there and I thank the Lord every day. Thank you for giving me this opportunity. I'm 70 years old and I'm still getting on my horse and riding. It's beautiful back there. The pronghorns are starting to have their fawns. And I don't know if you've ever been up close to those little guys, but they're darling. This is what God has created for us. And they're telling us that whatever they're going to build, what man can build is going to top what the Lord has provided for us back there. How can they be so pompous? We've all moved out there. Even if we don't ride, even if we just do nothing but sit on our porch and look at that beautiful prairie and watch those babies being born. That's what we moved out there for. That is what our Creator has given us. And they're telling us they're gonna improve upon that. How can you be so pompous as to think you're going to improve upon what God has given us? I made it through without crying. It would just, to me, it would just be a sin in what's happening to our beautiful state. What I don't understand what we're doing. I don't, what God has given us, what are we doing? That's all. Thank you.
Any further public comment, sir? Name and address?
John Mosley, and all I want to say, I don't have a lot of facts or anything, but there's just so many unanswered questions about these facilities here. Just so much that's unanswered. I just hope that you guys and us can get to the bottom of this, before any decisions are made. It's just too much at stake. Thank you.
Thank you.
Margaret Eisner, also out in Big Muddy Creek in the area where this is supposed to be built. And thank you again for your decision. Just for future reference, I think we've all become more experts than we ever thought, doing a lot of research. And one of the things that if this is looked at moving forward in the future that I think people need to look at is what's going on in other states and how they're backpedaling, that because they did not have the regulations in place. And the fact that we're trying to remove regulations to fast track these. And it's like, why? Who does it benefit? What's the purpose of moving it through? There's no independent long-term impact assessment that I've seen for health, for, our environment, our land. Again, we're all talking about, we're all going to lose property value and nobody's going to want to buy a house near a data center. I mean, I just came back from Virginia, where the most data centers are in the world. And that's a busy area because it's in 3 counties, Fairfax, Loudoun, and I think Prince William County. The amount of data centers there is unbelievable. They're built that are nowhere near as large as what they're talking here. There's under construction and there's some that are sitting empty. And one of the things we've never heard too, they say there's no client. I mean, are we just building this for the sake of getting something out there that there's nobody actually going to inhabit this? I mean, the equipment, what's the lifespan of the equipment? What do you do with it after 5 years? There's no taxes on that. How do you handle the waste from that? I mean, just a lot of things to think about. And again, thank you for your decision. But just as this, I don't think this is over, that it's going to continue to move forward, that we just wanted, to get our voices heard. So appreciate it. Thank you.
Thank you. And any further public comment?
Good evening, gentlemen. Rosemary Saban, Natrona County resident. I'd like to thank you for hearing the people tonight, and I feel like you guys are really listening, so thank you. I understand that with zoning, there's ways that this can be, the hazards can be mitigated. So I'm a little torn between citing or using zoning in place. But I'm ultimately, I think that the citing gives more opportunity for public comment. If in the future this board does choose to use the Industrial Park Avenue and a community benefits agreement, I would question its validity versus the industrial siting. Impact assistant payments. The legal confines may or may not have anything to do in that case with the impacts that would actually be seen in the community, like roads and infrastructure. So that's something that in the future, going ahead, whatever future discussions happen, I'd also like to wish you guys a happy and safe Independence Day. Thank you.
Thank you. Any further public comment? All righty, seeing none. Commissioners' comments. Dave.
Well, it's nice to see 4 of the candidates that are running for county commissioner in the audience tonight. That's always good. We're looking at our 250th anniversary of this country, which is amazing to me. There's a few of us that were around for the 200th, and I thought that was amazing too, with all the things that happened. But I'm looking forward to the celebration. I'm looking forward to this country continually moving forward and doing things. There's a lot of things that have happened that there are several sides to, and all I ask people to do is look at all the evidence, look at everything that's going on in the world right now, look at everything that's going on in this country right now, and it's not the same place it was 50 years ago. And some of it's better and a lot of it's not. And I think it's time for us to pull back together as a nation and move forward in the right direction. Thanks.
Mr. Laird.
Nice to see all y'all here. I am for economic development, but I'm not for economic development that hurts our people. I don't think I need to say any more than that. I am going to run for office again. There's some projects I would like to work on that'll take a while to do. We're losing 2 really good commission members, Mr. Nicolason and our esteemed chairman. What was your name again? Jim Milne, yes. They're all good guys. They really are. We've had our arguments. We've had a lot of stuff, but we've got a lot of things done, and we all are from here. We feel like we're with our people, and we're going to protect our people. Thank you all for coming.
Commissioner Nicolason.
Nothing tonight, thank you.
Commissioner Coates.
So I appreciate everyone coming and voicing their concerns and their feelings about the potential for a data center. I think it's important, and public discourse of this variety does make a difference. Over the past year and a half, I've had the privilege of hearing from Commissioner Nicolason saying that, it's the people, and it is the people that matter here. So, as we move forward and work through these processes, it's the people that truly shape how this county moves forward, economically, culturally, socially. The people are our greatest asset. So, to repeat what Commissioner Laird says, beyond that, year and a half ago, it was my campaign that, Natrona County is a special place and we need to keep it that way. So I hear everything you're saying. I understand the water concerns. I understand the other environmental concerns, and I will do my best to research those to the fullest extent possible. I do believe that industrial siting at this point in the game is probably the most appropriate place, because this county doesn't have some of the capabilities to really delve into some of these bigger issues. That takes some staffing that we don't have. And so these processes are built like the ISC to handle some of these bigger issues. So that doesn't mean we shouldn't have a say. And Commissioner Nicolasen's right that this county has a responsibility, as do the commissioners, to stand up and have our voices heard at that state level too. So I appreciate everyone being here and keep talking to us.
Your time was up a while ago. Dallas is big, man. Dallas was short tonight. I know. So Sunday was kickoff with Bulls and Bronx for CNFR. Tonight is first real night of rodeo. Kids are here. A lot of great people have come into our town. Please welcome them. During the armbanding ceremony, there was over 1,000 people participating at that banquet. It was amazing seeing all those college kids being there. Some of them for the last time, some of them for the first time, but it's a once in a lifetime. So I definitely encourage everybody to get some tickets, go see the kids, encourage them, and welcome Casper if you see any of those kids running around. With that, I got a rodeo go, so we're adjourned.
And I like it when you're fast.
I am fast. You're never fast.
I was tonight.
Well,
Thank you so much.
Sure.
That's complicated. It's complicated for a couple of reasons. You know, we can have stuff there about 3 months a year. Which house are you in? So as you're going toward our property and the whole